Facebook community. Um, so, new week, new topic. I hope this is beneficial to you guys because I want to educate folks. I just don't know if this is what you want to hear or not, but I'm just going to keep moving on and hoping that this is helping you and that you're getting some actual benefit out of these videos that I'm doing. So this week I want to talk about neuropathic pain and the use of CBD and cannabis in that setting. And of course, as usual, I'm just going to start with a description of what neuropathic pain is, and then today we'll talk about the conventional approach to this problem. So, a lot of people struggle with neuropathic pain. Um, there is actually quite a bit of research out there in terms of how cannabis and CBD can address this type of pain syndrome. Actually, more than other chronic conditions that we've talked about so far. So it's a good sign because they're actually finding benefit in the use of these products with this kind of pain syndrome. So, what it is it's a chronic condition that's caused by damage to the nervous system. So somewhere along the pathway, your neck, your back, your upper mid back, your thoracic spine, or your lumbar spine, which is your lower spine, you can get some damage somewhere along there. And if there's damage in your central nervous system, then that means that you're going to have signs and symptoms in that area, maybe, but probably most likely you'll have something that is actually a sensation that you feel that's away from the body part that's affected. So if it's your neck, then you might have what we call radiculopathy or paresthesias that start because there's some sort of derangement in the actual neck spinal cord, that's causing an impingement of a nerve somewhere in there, and so it radiates down to wherever that nerve is innervating. So that would be a sign of something going on inside the neck if you've got symptoms that are like up here in your upper part of your arms, or down to the elbow, or even to the hands. The hands, though, can also be a result of maybe carpal tunnel. Maybe you've got some compression of your median nerve here that lives in this little tunnel called your carpal tunnel. And that's usually caused by repetitive movements, a lot of typing. If you're a hairstylist or something like that, you might be more prone to having carpal tunnel. And so that can lead to some nerve derangement because that tunnel will swell and the nerve that lives in that tunnel will become compressed, and then it results in heaviness of the hand. Your hands feel sleepy, they hurt, that sort of thing. So that would be like a carpal tunnel thing. You can also have that same thing happen in your elbow, your ulnar nerve. Sometimes they have to go in and release that ulnar nerve area there where the nerve can have some space to move through that tunnel. It can happen in the foot too. It's so weird, but anyway, the actual nerve derangement or dysfunction or damage to that nerve can cause those symptoms that live further down in the body, your arms, your legs, your feet, or in the central nervous system as well. So it results in this altered sensation in the extremity. And there is one other really serious, debilitating form of neuropathic pain. It's called CRPS. It stands for chronic regional pain syndrome. We used to call it reflex sympathetic dystrophy, but usually this happens. So if you've got an injury, let's say you break your ankle, and the ankle doesn't heal quite like it should. And so you break the ankle, and the nerves are involved because you broke the ankle. And in a normal setting, your ankle should heal without any trouble. But in the abnormal setting, those nerves can become impinged and damaged, and it results in this thing called RSC or CRPS, and it's extremely, extremely painful. In a lot of these symptoms or syndromes, you can have pain that's so exquisite that even a sheet brushing on your foot, for example, or your ankle, for example, can result in just extreme discomfort. So another very, very common neuropathic type of pain is from sciatica. So if you've got something going on in your low back, you've got a disc that's bulged out a little bit, so it's compressing on some nerves, and it results in um, traveling down your gluteus muscle or your buttock, and it goes through the sciatic notch in your pelvis or in your hip, and then it travels down the back of the leg and sometimes wraps around the leg and sometimes can go all the way to the foot. So that would be sciatica. Let's see, what's another? Oh, diabetic neuropathy, of course. So if you've got neuropathy of diabetes, then that's a condition where the nerve has been damaged because there's too much sugar in your bloodstream, and it damages the nerves in the lower extremities and the feet. So the this kind of pain can be so debilitating, and it can be incredibly difficult to treat. And it results in people having a very difficult time performing just everyday tasks. So it's something that we really want to try to get a handle on as far as getting outside the box and treating, using more plant-based medicine and sometimes in conjunction with your conventional medications. But let's talk about what those conventional treatments might be. So, providers used to readily prescribe opiates, but in the opiate crisis that we're in, it's in full swing, and prescribing habits have changed, thank goodness, because we don't want people getting a lot of opiates and becoming dependent on them. So now the first line medications for treating neuropathic pain of any kind really is gabapentin or Lyrica, which the other name for Lyrica is pregabalin. And then tricyclic antidepressants like amitriptyline is another choice. SNRIs, which are serotonin norepinephrine reuptake inhibitors, like duloxetine or venlafaxine, are another choice. If those don't help, then, or if they do but not quite enough, then you might be prescribed an opiate like tramadol or tapentadol. These are milder opiates, but they're still opiates, and we don't want to have to rely on those. And then there's topical medications also like capsaicin, which is actually the substance that comes in hot peppers, and they have managed to get that inside a cream, topical gels and stuff like that. So that can help, which is really a plant medicine, so that's pretty cool. But also lidocaine patches or gels are another topical approach. And then the very last couple of resort medications would be stronger opiates like morphine or Oxycontin or oxycodone. And then lastly, injections like Botox into the affected area. The problem with all of these, obviously, is first of all, most of them you're going to use long term because this is not an overnight fix. So you didn't get neuropathy overnight, you're not going to get rid of it overnight. It's going to be a long haul approach. And so if you have to use these medications over the long haul, you could really struggle with a lot of the side effects that come along with these meds. So side effects would be something like, you could get something like QT prolongation that's in your heart. And that means medications like amitriptyline, that's a big culprit for causing that one. You could have nausea. You could have constipation, ataxia, which means you're kind of wobbly and jittery when you walk. Dry mouth, hypertension is another side effect. Dizziness. If you're using a topical, you might have a rash at the application site. Like if you're using a gel or a patch or something, it might irritate the skin. So these are all, okay medicines, and it's really all we've had. But if there's a possibility that using plant-based medicine, including your cannabis, your CBD, and your essential oils, then why not if that's something that can help? So moving on, I will be talking more about how the cannabinoids work and how you would use those. And I'm actually going to give you some patient examples of ways that people have tried these products and the result, the outcome of using those products. So guys, ask questions, comment, and let's boost the algorithm so that people see this stuff, okay? Appreciate you guys. Thank you. Bye bye. Get out of here. Where's my finish? Uh-oh. Covered up. Here we go. See ya.